Hello, and thank you for joining us for our presentation on peer mentorship for people with intellectual and developmental disabilities. My name is Kelly Friedlander, and I am the Principal Consultant at Community Bridges Consulting Group. I'm also the Project Director for the North Carolina Council on Developmental Disabilities Peer Mentor Training Pilot for people with IDD, which I'll be talking about later. Dan Ohler, the Vice President of Public Sector Health Services at Optum, will be joining the session at the conference. I'll be covering the slides today. I'm sure many of you attending the conference are familiar with the concept of peer supports. Peer support has existed in the behavioral health sphere for decades. Its rapid growth in recent years is for good reason. Research and experience shows that peer support specialists have a transformative effect on not only individuals' lives, but on the system. So, what exactly is peer support? Peer support encompasses a range of activities and interactions between people who share similar experiences of being diagnosed with mental health conditions, substance abuse disorder, or both. Peer support offers a level of acceptance, understanding, and validation not found in many other professional relationships. By sharing their own lived experience and practical guidance, peer support workers help people to develop their own goals, create strategies for self-empowerment, and take concrete steps towards building fulfilling, self-determined lives for themselves. Peer support worker is someone who has lived experience of recovery from a mental health condition, substance abuse disorder, or both. They provide support to others experiencing similar challenges. Peer support workers provide non-clinical, strength-based support and are considered experientially credentialed by their own recovery journey. Peer support workers can help break down barriers of experience and understanding, as well as power dynamics that may get in the way of working with other members of the treatment team. The peer support worker's role is to assist people with finding and following their own recovery path without judgment, expectations, rules, or requirements. And we know peer support works in behavioral health. Peer support is recognized as an evidence-based practice for individuals with mental health conditions or substance abuse disorders by the Center for Medicaid and Medicare Services. Why? Because quantitatively and qualitatively, we have evidence that indicates that peer support does the following things. It lowers the overall cost of mental health services by reducing rehospitalization rates and the days spent in inpatient services. Peer support also increases the use of outpatient services, improves the quality of a person's life, improves and increases engagement with services that will assist an individual in their life, and increases whole health and self-management. So at this point, I'm sure you're thinking, that's great for people with mental health and substance use disorders, but how does this or can this all affect people with intellectual and developmental disabilities? Let's start with some basic facts. The US has more than 7 million individuals who are living with an intellectual or developmental disability. The majority of these individuals we know rely on Medicaid for their health insurance needs. As Medicaid managed care gains traction in the United States, a growing number of people with IDD are now receiving their insurance coverage through a Medicaid managed care program. Unfortunately, even those who receive services through a Medicaid managed care program still have a lot of challenges. As someone who chose to attend this session, I have a feeling that you may be aware of some of the most pervasive challenges that are facing people with IDD. These include aging. The field has changed a lot very recently. We have better healthcare. The deinstitutionalization movement is still alive and well. And for the first time in history, Americans will experience millions of people with IDD living into their senior years. These Americans with disabilities want to enjoy their older years in the same manner as other people their age. Like other older Americans, people with IDD may require greater levels of support to allow them to live full, active lives in the communities. In addition, family members of people with IDD often lack information about or access to resources that will help enable them to support the person who is growing older. Another challenge faced by people with intellectual and developmental disabilities is overall health and wellness goals. We know individuals with IDD have a harder time than the general public accessing high quality care. A systematic challenge we have in the field is making sure that we amplify voices of people with disabilities in authentic ways. We know that CMS requires that each state develop meaningful consumer engagement, and CMS has oversight that ensures follow through. But meaningful engagement goes beyond commenting on the initial proposal, attending a meeting, or reviewing information posted on the state website. Put simply, these programs cannot achieve patient-centered care without engaging patients and their advocates in a collaborative way. Collaboration with consumer advocacy groups is critical, and we should ensure that beneficiaries' voices are heard in the design, implementation, and oversight of new initiatives. One of the hardest challenges to address for people with IDD is that of loneliness. People with disabilities experience loneliness, low perceived social support, and social isolation at significantly higher rates than people without disabilities. We know based on research that lower social connectedness is associated with lower overall well-being. Another major challenge, including a challenge here in North Carolina, is housing. People with IDD face a housing crisis with many contributing factors, such as a serious lack of safe, affordable, accessible, and integrated housing, and significant housing-related discrimination. And while home and community-based services have improved the lives of those with IDD, we know that there are still significant areas for improvement. According to NCI data, 48% of people with IDD want help making or staying connected with friends. Only 20% of people with IDD are engaged in paid employment in the community. And according to NADD, 35% of people with IDD experience mental health challenges. That is a lot of challenges for people with IDD, their family members, providers, managed care organizations, and state agencies to tackle. This chart shows a hypothetical example of what might happen if an individual received effective holistic support in all areas of their lives. If there's less focus on segregated services and more emphasis on community inclusion. We believe that the utilization of peer mentors for people with IDD could be an instrumental tool in getting an individual's schedule and their lives more colorful, vibrant, fulfilling. And we are not alone in that belief that peer mentors can help make someone's life more vibrant and colorful. Across the country, IDD peer mentor programs or peer support programs are slowly appearing. Michigan has 57 people with IDD who are certified peer mentors, working in 11 community health service programs, which is their equivalent to LME-MCOs. In Philadelphia, there is a community autism peer specialist program called CAPS. CAPS pairs an individual on the autism spectrum who has completed a peer support training program with other individuals on the spectrum to achieve their personal wellness and community integration goals. In Tennessee, their waiver offer peer support for people with IDD and their families to help them get actively involved in their communities. There are also variations of peer support in the IDD world, such as family peer support and college peer support. One thing that isn't on this slide that I should talk to Optum about adding that you may be familiar with as a North Carolinian is the Family Navigator service offered at Trillium. Family Navigators advise families and people with intellectual and developmental disabilities or traumatic brain injuries. Family Navigators help them learn about the complex system of services and supports by using their training and their personal experience. Optum believes that peer mentors with IDD can positively impact the lives of other individuals with IDDs and their families. To support our goal of increasing peer mentor programs for people with IDD in the United States, we are currently developing and testing a peer mentor training curriculum. The first pilot of our curriculum happened in North Carolina with the following partners that you see on the screen. So Optum set about to develop the curriculum. We knew there were a lot of good projects and programs going on across the United States, and we wanted to build on their success and their knowledge base. Community Bridges Consulting Group conducted an environmental scan. We were particularly looking for training or curriculum that could be adapted to manage long-term supports and service navigation. Ironically, The curriculum that we identified was a North Carolina-based curriculum. It was developed by InReach, a provider located in Charlotte. The curriculum is authored by Pat Kuehl and 4 self-advocates. Community Bridges Consulting Group and Pat Kuehl of InReach reviewed and modified the curriculum, and now the curriculum contains 12 lessons, and each lesson plan includes a PowerPoint presentation, a chapter narrative and journal writing activities, art and role-playing activities, and pre and post quiz for each chapter. In addition, the curriculum includes the final test that a participant must complete and achieve 85% or above to receive their certificate of completion. With the curriculum drafted, it was time to find a place to test it. Optum chose North Carolina as the state to test its peer mentor training program for people with IDD curriculum based on its strong relationships with organizations in the state and because of the partnership it could have with the North Carolina Council on Developmental Disabilities. The North Carolina Council on Developmental Disabilities, or NCCDD, was a perfect project partner and a unique one. One thing that makes it unique is the 40-member governor-appointed council must consist of at least 60 people with disabilities and family members. In addition, its members have broad professional policy and lived experience. Upon the blessing of its members, the NCCDD entered into a partnership with an ACDD, so many acronyms, and Optum to support the project through recruiting, interviewing, and assisting in the selection of the cohort, assisting with any accommodation needs that would be necessary by members of the cohort, and to help develop local connections and provide guidance that could advance the project and the idea of peer mentorship in the state of North Carolina. With project partners in place, it was time to get started. We needed to advertise and recruit for the pilot training cohort. We needed to conduct the pilot training, and we needed to develop and administer evaluation activities that would help us identify the strengths and the weaknesses of the curriculum so that we could modify it and make it better. The peer mentor training program for people with IDD curriculum was developed and finalized in 2019. At that point, training was envisioned as being multiple days in person, scattered across the state. But as we all know, a lot changed between 2019 and when the funding for the project was approved, 2021. COVID-19 turned everything in the world upside down. And just like everyone else in this field, we adjusted. We made all components of our program virtual, from advertising to recruitment, to class attendance and participation, to the assignments that the students were given. We had a 2-week window to recruit candidates. We thank all of the stakeholders who helped us advertise this and had a wide reach. We received over 100 applications within the 2-week window. I gotta be honest, I was actually really surprised that we received so many applications. And once I started going through the applications, I was really amazed at the breadth of the background, experience, and diagnosis of the applicants. As you can see on the slide in front of you, we had a variety of diagnosis, demographic, and educational levels of the people who applied. One of the most important factors of the application was a short answer response section where they were asked a question that they had to respond to. One of the questions asked was, why do you want to participate in the peer mentor training program? As you can see on the screen, applicants gave very thoughtful answers. I want to participate in the peer mentor training pilot because I want to be a better advocate, not just for myself, but for my community and family. We were amazed at the amount of insight that applicants showed and how much they wanted to pass forward the knowledge that they had acquired through navigating the system on their own. They wanted to make it easier for other people behind them. Another thing that was just astounding was asking about the work or life experience that would make them a good candidate. And these applicants were qualified. We had a lot of individuals who had participated in leadership programs at colleges or Special Olympics. And we had individuals who just stated my lived experience trying to navigate the system, being frustrated, trying to find the right support. really, I think, makes me a candidate for this. After we received the applications, we had to modify our interview and selection process a little bit. We were not anticipating 100 applications. So the North Carolina Council on Developmental Disabilities helped design an interviewing and selection process for the training cohort with this flood of applicants. First, applicants were blindly scored by council staff with their names and identifying information omitted. The top 20 applicants were offered interviews. Of those applicants, 19 individuals interviewed. One individual had received a job offer and rescinded their application. Interviews consisted of the applicant, one facilitator, and 3 selection committee volunteers. And the selection committee volunteers used standardized questions and submitted their scores of the individuals interviewed electronically. Now, I would like to introduce you to some of the 15 cohort members that were selected, so you can hear directly from them why they applied for the training program.
My name is Brianna Thompson, and I live in Durham, North Carolina.
My name is Brittany Ellis, live in Zebulon.
My name is Dakota Wilson, and I'm from Alamance County, North Carolina.
I'm David Camillo from Mooresville, North Carolina, and my disability is high-functioning autism.
My name is Isha Munshi from Durham County, North Carolina, and I do have constitutional disability.
Hi, I'm Gil, and I'm from North Carolina, born in May.
Hi, my name is Michael. I am from Haw River, North Carolina, and I am on the autism spectrum and have severe anxiety and depression.
I'm Miles too. I'm from Mali. I have Down syndrome and Hashimoto's encephalopathy.
My name is Essence, like the essence of life, last name Scott, Scott, and I live in Goldsboro, North Carolina, in Wayne County.
Peer mission is fantastic.
I applied for the peer mentor training because I want to learn about leadership and take that leadership and put it to good use.
I feel like this could finally be something I'll be successful with and also be able to help people with, because that's one of the main things I've always wanted out of a career, is actively being able to help people.
Well, I'm hoping that this training would enable me to help more people who have IDD.
The skills to become a better mentor and how to support my peers.
What I hope to learn is to help other newcomers to North Carolina who are disabled and who are in that 30-ish age range get better support.
You see something that's related to you, go for it, because it's really important that people get the help they need as much as they can.
Help people in our lives that fit us and help us. We feel part of this is that we've never received for ourselves before.
Thank you for the question, Ashley. Thank you. Appreciate that. It makes me feel good, and also makes the peers feel good too, because it's good to have a source other than your family.
It's time peace support.
The 15 individuals selected for the pilot attended a total of 8 two-hour training sessions via Zoom. We had no unexcused absences, 100% attendance. In addition, honestly, some of the best Zoom etiquette I've seen ever. The cohort was engaged, they participated, and they really seemed to embrace the virtual nature of this initiative. In addition to attending and participating in trainings each week, the cohort will receive an email like you see on the screen from me Each week, it outlined all of the tasks that they had to complete before the next class. And they did. They completed creative journaling assignments, holding up collages that illustrated to them different emotions, iPads that had hand-drawn sketches, reflecting with their cohort about topics like self-determination, sharing stories of their own experiences with conflict resolution, and also talking with each other about how their choices in life have and have not been supported so far, and how they would support someone making their own choices in their lives. In addition to evaluating the impact and efficacy of the initial peer mentor training, students were asked to complete several online surveys focusing on the content of the training and the overall experience. Participants were asked to fill out pre and post tests for each lesson related to the content that was taught and discussed. Test questions focused on useful knowledge that peer mentors should have and the application of knowledge in simulated situations. Results of the pre and post test were analyzed to assess change from the beginning to the end of the lesson. Overall, the pre and the post test were designed and analyzed to understand participants' knowledge gain throughout the program. On 8 out of 11 surveys, our analysis showed that participant scores increased from before the lessons to after. These results indicate that the training was beneficial to increase the knowledge and skills of these peer mentor cohort students. The increase in score range from 1 to 6%, though, demonstrated that while participants did gain knowledge and were better able to apply critical peer mentoring skills, most of the cohort began their training with a strong set of baseline knowledge. Here you can see the distribution of peer mentor scores for the final test. All students who participated achieved the 85% threshold required to receive the certificate of successful course completion. Being a pilot, we also consistently requested and received feedback on what the students enjoyed and found beneficial in the class and what they did not enjoy. Trends that were identified included students wanting more time dedicated to role playing. That discussion time among cohort was highly valued and they really enjoyed breakout rooms. Many students said that they learned a lot from hearing about each other's experiences. And finally, multiple cohort members said that they would love an opportunity for real life application of what they were learning. They wish that there was a real life experience that allowed them to put what they were learning to use. So what are the next steps? We're currently refining the curriculum based on the feedback that we received from the first cohort. Changes being made include adding sessions and discussion time to make sure there's time to dive into complex topics such as self-determination, adding more role-playing and breakout activities so the individuals can practice the skills they're learning in session, and modifying homework assignments so that they can be more easily completed and shared with the instructor in class in a virtual format. Next, we need to engage potential employers and start collecting data. We have some positives that have been identified in making peer mentoring for people with IDD a reality, but there's also real challenges ahead. First, the positives. We know that individuals with IDD are interested in potentially being peer mentors. We had 100 applications in 2 weeks. We also know that individuals with the IDD believe that there's a benefit in having a peer mentor. In addition, a variety of stakeholder organizations have contacted the initiative to learn more about it and see if there's a way that they can get involved. And finally, and a big positive, is the fact that the Center for Medicaid and Medicare Services, CMS, has approved peer mentoring or peer support service definitions in other states. But we do have challenges here in North Carolina. We don't have an approved service definition in this state. And part of the reason why we don't have an approved service definition in the state is we don't have enough data or case studies completed and compiled to stop. Now on to the challenges. We do have some challenges to overcome. First, most importantly, right now we don't have enough data or case studies completed and compiled to effectively advocate for a peer mentor service definition in North Carolina. Because there's no funding stream or service definition, right now graduates have no clear employment options. While many stakeholders have reached out with interest in the program, potential employers are hesitant to hire at this point in time. There's no revenue stream to cover the costs that would be associated. There's concerns about the best way to possibly deploy a peer mentor role within organizations. And organizations are concerned about the capacity to integrate and supervise a new role and position, especially as they're getting ready for tailored plan launch. And the third step, we are getting ready to recruit and train another cohort. I'm very excited that the North Carolina Council on Developmental Disabilities has approved funding for a second peer mentor training cohort. To stay up to date and receive a notice of when the next application window opens, please visit our website, iddpeermentor.com. As we look forward, it will take the collective impact of many stakeholders to make peer mentoring of people with IDD a reality. If you're part of an organization that is interested in exploring what an IDD peer mentor position could look like in your organization, please reach out. If you have information, thoughts, or suggestions that you think could help advance this initiative, we welcome them with open arms. I can be reached at the contact information that you see on your screen. Last, but certainly not least, we want to say thank you to some important people that this would not be possible without. Thank you to Pat Kuehl and the 4 IDD peer mentors who helped author the base curriculum: Laura Newell, Frank Davis, Chelsea Brantley, Menelek Kandi. And thank you to our first cohort of students who were willing to take a chance and try something new. Their commitment to the project was amazing, and their critical and constructive feedback helps us move closer to peer mentors with IDD being a reality. Thank you so much for attending this session. If you have any questions, please feel free to reach out. Thank you, and I hope you enjoy the rest of the conference at Pinehurst.